Hi, welcome to Empowered PT with Dr. E. Today I'm going to teach you some exercises that you can perform if you've been diagnosed with carpal tunnel syndrome. So in 2015, the Archives of Physical Medicine and Rehabilitation compared all of the different nerve glides that we teach patients essentially when they have carpal tunnel syndrome. And there was one in particular that was superior at creating more movement in this carpal tunnel in the wrist. So, and that indicates more movement of the nerves and particularly the median nerve. So that's what we want. We want that nerve to move in its sheath better. So I'm going to teach you the nerve glide that was found superior to all of the others. So what you're going to do to start, you're going to take the affected arm and you're going to raise it so that your elbow is directly in alignment with the shoulder. Okay, and you're going to start with the fingers extended and together. And from this position, you're going to just open the fingers apart into abduction, and then you're going to bring them back into adduction. So it's just an open and close. Good. And you just want to make sure that you're just extending the fingers enough that you feel some tension and stretching, but not going into sharp pain. And you will more than likely especially feel this if you take the thumb out too far. So just be mindful of feeling some stretching and tension, but not going into that sharp point of pain. So you're going to try 15 to 20 of these, and I want you to always start with that nerve glide before you go into the other exercises. And you can do that exercise per your tolerance, 3 to 4 times a day, 15 to 20 repetitions at a time. All right, so the next exercise I'm going to teach you is a ball squeeze. So you're going to hold either a TheraBall or any small ball that you have at home would work, a golf ball, just something that you can grip those fingers around. And then you're going to take your unaffected hand and you're going to support the affected hand. And I'm just supporting it right at the wrist here, and that's going to prevent me from going into the extreme of extension or flexion. It's just going to help to keep my wrist neutral. So you're going to squeeze the fingers into the ball, holding for 5 seconds, and then you're going to open the fingers up and apart for 5 seconds. So we'll squeeze and hold 5 seconds, and then straighten and hold for 5 seconds. So this exercise works on strengthening the forearm muscles, but it also helps to strengthen the flexor tendons in the hand. And we're opening those fingers up in between just to give it a little stretch between the repetitions. So this one you can start with 2 sets of 10, holding 5 seconds, and working your way up to 3 sets of 10. And these exercises can be done 2 times a day is plenty. The next one we're gonna do is a wrist extension with a small weight. Now, you can certainly do this without the weight too if you experience any discomfort, but you wanna make sure that you are not over gripping that weight. Nice loose grip. My forearm remains down on the table, okay, and I'm just lifting from the wrist into wrist extension. So I'm lifting this way. Just enough that I feel a gentle stretch in that carpal tunnel, and then I'm returning to neutral. So holding a few seconds, back to neutral. I'm not letting my wrist drop all the way down into flexion because that's going to close off the carpal tunnel. So I want to just stop it right back at neutral. Okay, so this exercise as well, you can do it with a 1 or a 2 pound weight, whatever feels appropriate, or you can just start without the weight and just doing the movement. Okay. All right, and that exercise can also be performed twice a day, building up to 3 sets of 10 repetitions. Then I want to teach you how to stretch out the wrist and the flexor tendons. So I'm going to have you actually hold the arm down a little bit lower than shoulder height, and then you're going to just gently press the fingertips back toward you. So we're getting a stretch here on the underside of the arm. And if you can get the thumb into the stretch as well, that's ideal. But just be gentle with the pressure. And this one you want to hold for 30 seconds. And then you're going to slowly release out of it and try 2 repetitions. Now I like to teach it at this angle because if you bring your arm all the way up this way, sometimes you end up feeling it more in the shoulder, and holding the arm down low just isolates it a little bit more in the wrist and the forearm. If this position is uncomfortable, you can also flip the palm up and gently press this way. Whatever feels more comfortable for you. They're both stretching the same muscles. Okay, so fingers back or palm up and fingers back. So that exercise you can do 3 to 4 times a day, 30-second hold, 2 repetitions of each. And the other stretch that I really like is the prayer stretch. So bringing your hands together and then trying to press it down toward your abdomen just as far as you can until you feel a stretch on the underside of the wrist. And then holding this also 30 to 60 seconds, 2 repetitions so you can come out of it, take a little break, come back into it. And you can also do that stretch 3 to 4 times a day as needed. Also, make sure that you are wearing a night splint at night and that you are paying attention to your ergonomic workstation and that you're making sure that your wrists are not in the extremes of extension or flexion. When you're typing, you want them completely neutral, like this. So you can check out my ergonomic video. And the other thing that you can do is if you feel the symptoms come on during the day, you can simply just shake the hands out. Okay, and this just helps to stretch out the flexor tendons that pass through that carpal tunnel and extend into the fingers. So just shake those hands out for a couple seconds, and you can do that as needed throughout the day. Thank you so much for joining me today. I look forward to seeing you on the next video. Take care. Have a great day. Bye-bye.